Welcome to today's seminar at the Center for Global Health at the University of Oslo, COVID-19 Rethinking Our Relationships with Wild Animals and Wild Places. Before we start, I just wanted to make you aware of a couple of housekeeping issues. When you registered, you agreed to the session being recorded so that we can share the link with people who are not able to attend and potentially also store the webinar in our archives. So we will record the session. When you want to ask questions later on during the second half of our webinar, you have got the possibility to do so in writing in the Q&A section. You can do this either under your name or also anonymously. We can only choose a couple of questions because of time, and I will read those questions out. You will be muted at all times, and you do not have the possibility to speak yourself, unfortunately. This webinar will be a 30-minute conversation with myself. My name is Andrea Winkler. I'm the director of the Center for Global Health here at the University of Oslo, and I also co-chair the Lancet One Health Commission. And Dr. Chris Walzer, and followed by a 30-minute open Q&A session. Without further ado, I would really want to introduce our interviewee, and I'm very pleased to have Dr. Chris Walzer here with me today, who is a board-certified wildlife veterinarian, executive director of health at the Wildlife Conservation Society, and professor for conservation medicine at the University of Veterinary Medicine in Vienna, Austria. And Chris, you have an internationally recognized expertise in working with wildlife and gained from combined years in leadership and research in Europe, Asia, and Africa. You have authored more than 100 peer-reviewed research articles, numerous book chapters, and you lecture widely in the field of wildlife health and biodiversity conservation. So I couldn't really think of a more knowledgeable and suited person on the topic of coronavirus and wildlife. And I'm very, very happy that we have you here with us today. So just
Thanks very much, Andrea.
Welcome, Chris, again. Chris, to warm up our audience, now we just start with the first question here. Could you introduce us to the business of wildlife markets in China and other places, and give us some accounts of the situation in those markets, and potentially also compare Asian and African markets? And finally, explain what we do know and what we don't know about the origin of coronavirus. Chris, over to you. Thank you.
All right, thanks very much for the introduction, Andrea. Good morning to everyone from the Bronx. So yeah, the markets in Southeast Asia are rather exceptional. So one of the things, just right off the bat, I want to say about wildlife markets in Southeast Asia and China is that the animals that are traded there are, for the most part, alive. So these are animals which are alive, which have been captured throughout the region and sometimes globally, have been brought together at these huge markets in cages, are often stacked on top of each other. And just to give you an idea of the magnitude of some of these markets, some of them will have up to 50 to 100 wildlife species together alive, together with domestic animals, mostly poultry and pigs, and they're stacked on top of each other. These are large markets in urban areas. So they serve mostly an urban population in this case, or at least the ones that we're particularly concerned of. They're very large. They bring together, of course, the animals. These animals have the possibility to shed their viruses and exchange viruses between these multitude of species. And then on top of that, the animals are actually processed at the market. So then you additionally also have blood and organs exposed, which obviously is, as we all know, is probably a really good way of breeding new viruses, and at least for exchanging viruses and other pathogens. That contrasts quite a bit to markets in other parts of the world. First of all, due to the magnitude, there are no markets of this size anywhere else in the world. Most of the other wildlife trading markets on the global scale in Africa and even in Latin America, the animals are dead. So that's already a really big advantage on this, on the point of view of disease prevention. They are just not able to shed viruses anymore and exchange them with other animals at that market. In Africa, one of the other advantages is that the wild or bushmeat products are often smoked. So that also helps that kind of conservation of the meat, does help in reduce any kind of infection risk from these products. That being said, of course, the infection risk exists from all the markets, irrespective if the animals are live or dead. It's just an order. It's just a question of risk, because it is a numbers game, of course. So the point being that large commercial markets with multitude of species that are alive constitute a higher risk than markets where there's lower number of species and the animals are dead. That's sort of in a big sum. The other thing I think really important to know or to understand at this point in time is that the markets of Southeast Asia, and especially in China, are serving and mostly an urban population, the sort of the new middle class that has the financial resource to actually buy this expensive product. Remember things, you know, the extreme example is always the pangolin, which has been touted so much in the media recently. But to buy a pangolin, you do have to spend a lot of money. It's actually a status symbol, and it doesn't fulfill any kind of nutritional needs, which is quite different than some of the markets in Africa where millions of people are still dependent on wild meat and bush meat for their protein, for their daily protein requirements. So we do have to be very nuanced there when we talk about these markets.
Right, and now, of course, the question: what is it that we know and what we don't? What is it that we know and what we don't know about the origin of the coronavirus, and about the studies and the evidence that is out there already?
Yeah, so it's you know, it's we know a lot, but there's also a few really significant things that we don't know. Some of us were around in 2002 and 2003 already working, and we remember SARS. So this has been overwhelming, the amount of knowledge that is being shared at the moment. I was looking at the Lit COVID server this morning, and I think it's at 6,000 since 6,000 manuscripts and papers have been shared since mid-January, basically, which is just baffling. There's no way you can even trace that. So what we do know is that the ancestral, and there's broad consensus on that, and that the ancestral or evolutionary host of this virus originates in a horseshoe bat species. You know, one of the horseshoe bats are widely distributed throughout Southeast Asia and China, so that's not particularly surprising, and there's broad consensus on that. What we don't know, however, is how the actual spillover event happened. So the Wuhan wet market with its wildlife trading section has been brought up many times in this context, of course, and has been linked to about 50% of the original published cases, but not all. One of the things that's important, there were 530 some environmental samples taken at the time of the outbreak in the beginning of January. And of those, 33 samples were positive. And of those 33, 31, so basically the majority, originated from the western part of the market. And the western part of the market is where the wildlife was stored. So there's a really strong signal that wildlife dealing, the wildlife itself possibly had a very strong, you know, was at the source of this outbreak. That being said, we didn't know animals were sampled, it seems, and the animals were removed very quickly without any samples being taken. So we don't know if there was an intermediary host, which we assume there was an intermediary host in one of the other mammal species that were there. But we don't know at the moment. And, you know, I've been doing this, following this closely since January, and I've gone through a whole bunch of suggestions, you know, from crazy like snakes all the way to the pangolins, which have been touted a lot. But the truth of the matter, we don't know. Alternatively, what could have happened as well is you have a spillover event into a human population in a rural area, and you get a cryptic evolutionary phase no one notices, and a spillover back at the market then happens back into animals possibly, or to other humans at high densities. Those are the two sort of main hypotheses at the moment.
Well, yeah, thank you, Chris. So just to summarize, really, is that there is some evidence that the virus has emerged from that particular market. We do not know a lot or virtually nothing about the intermediary host. And pangolins are pretty much out of the equation, and snakes are very much out of the equation. Thank you. For giving us really those rare insights, because I'm not sure, have you ever been at such a market, Chris?
Oh, yeah, yeah, in Southeast Asia,
yeah.
Quite distressing, actually.
Yes, yeah.
For us, for our Western sensibilities, of course.
Yeah, no, I bet they are. And having listened to you about the wildlife markets, and especially about the market now in Wuhan, well, how likely do you think it is that the virus may have originated from somewhere else? And we had those press releases about the implication of a lab near the Wuhan market. So can you just, I'm sure our audience may be interested in that, just a couple of sentences on what your opinion on that is, Chris?
Yeah, so, you know, there is absolutely no evidence, just to be clear, there's absolutely no evidence that this virus escaped from a lab, either one of the labs in Wuhan or any other lab somewhere else. That being said, we know on a global scale that lab accidents happen. You know, anthrax gets shipped across half the globe and it was not inactivated, it was in a cardboard box, you know, that kind of stuff. It does happen. But there really is absolutely no evidence for that. And you know, the most parsimonious and most obvious, you know, method would be that it used the market similar as SARS did, which is a very similar virus. And we know in that, or we assume in that case, that it came from a bat and then certainly passage through a civet cat. Unfortunately, those samples are not available. I'm sure there's more ongoing research. There's a lot of work definitely on human banked serum samples at the moment to see if there was maybe some cryptic evolution in humans. One thing I think we mustn't forget, this pandemic is being misused, if I may use that word, a lot for further political goals and trade advantages and all this kind of stuff. So, you know, the things you read in the media get pushed for completely different reasons. And I think we need to be aware of that.
Yeah, absolutely. Thank you, Chris, also to clarify this, and that, of course, there's a political angle. On the other side, one can never be sure. And as you pointed out, things do happen. But there's absolutely no evidence about a lab accident or incident near the market. But that, I think, is already very, very helpful. So still remaining with those wildlife markets in China and other places, as you have pointed out very nicely. In which way has the government of China already taken action to ban those markets? And we hear that there's lots going on. And what is at stake of such a ban? So talking about the business behind those wildlife markets and the economy also that has been established around those markets. And how sustainable do you think this will be?
Yeah, so that's a very, very good question. So as you know, the government of China reacted very, very quickly by imposing, first of all, a temporary ban on absolute all trade in wildlife for any reason whatsoever throughout the entire country. And they really did enforce that. I mean, our office in the country, you know, checked if this was being enforced, and basically there was within a week, there was no wildlife being traded anywhere, neither on the e-platforms, in the restaurants, anywhere. And China then followed up at the beginning of February with the Central Committee and 11 ministries, and you know, an agglomeration of administration and ministries making a very clear statement that they would further a permanent ban of all wildlife trade related to consumption. And since then, since February, you know, they've been working on legislation. There were three pieces of legislation which are being adapted at the moment. WCS has been supporting the administrations in, rewriting and evaluating these pieces of legislation. And the good thing is this has really come from the Central Committee, and President Xi Jinping has, issued a public statement, which obviously is a very, very strong signal. Similarly, then the government of Vietnam at the beginning of March, the Prime Minister of the government of Vietnam similarly issued a statement that Vietnam would follow suit and also ban wildlife for consumption. Now, there's a lot of worries that, this will drive the trade underground and there'll be more illegal trade and so on. So the simple answer to that is that, yes, there is illegal trade already. Remember, any pangolin you saw on the market that was alive is completely illegal since more than a decade. All this has been illegal, but the point is, there is a really good enforcement, and strengthening the enforcement and the intelligence necessary will prevent that. And the illegal trade is always only going to be, so much smaller than everything that had been tolerated now. And remember, this is not only about illegal wildlife, this is also about the use of legal wildlife. It really doesn't matter from a disease point of view if the bamboo rat was legal or illegal. It just still carries coronaviruses and other viruses, and you can be subjected to them. So I'm very optimistic. I mean, the governments are moving forward very rapidly. I think in 2 to 3 months, this will be enshrined in the national legislations, both in Vietnam and China. I am sure Cambodia and Laos PR are going to follow suit. I don't think there's too much doubt about that. I think the big one at the moment we don't know much about how it's going to go is Indonesia, which has some of the biggest markets in the area. And we haven't got very strong signals from Indonesia moving to ban these markets yet. So that's one we have to see.
No, well, thanks a lot, Chris, and hopefully that this can be sustained in one way or another. We're doing good with time. We are halfway through our first part. So we are moving now to question 4, 5, and 6. I just wanted to remind the audience, we have one question already coming in. So if you want to ask questions later on, you can start thinking about your questions, and please do type them into the Q&A section. Thank you. Now we just shift a little bit. I would like to ask you about the One Health concept, which we understand, human, animal, and environmental health viewed together. Could you tell us a bit more about the One Health concept and how this could be applied to the COVID-19 pandemic? And we all know, we should know that One Health is actually being coined by veterinarians very early on last century and even before that. And it was very much the link between humans and animals and humans. So of late, the environment has also come in, and that of course is very, very important. How do you see this from your own veterinarian perspective?
Yeah, if I may just take, thanks very much for that. That's a really also important context that we obviously, which has become very timely. So let me just take one step back. So basically this concept's been around for a long time, of course, and also the inclusion of the environment into health has, it has historic perspective. So many have discussed this in the past, but it's sort of really been consolidated. In 2004, the Wildlife Conservation Society pulled together a meeting in Manhattan and coined the so-called Manhattan Principles, which really were quite focused at the time on infectious disease and the emergence of infectious disease and the environmental conditions that allowed these spillover events to occur. But in 2019, in October, with the help from the German Federal Foreign Office and yourself and many other colleagues, we had another meeting in Berlin with some 200 participants. And we actually sort of basically moved on from Manhattan to Berlin and have coined the Berlin Principles and really strengthened these ties way beyond the classic or perceived classic One Health concept, which is just sort of veterinary medicine and human medicine, by really integrating tightly the other drivers, of course, environmental change, climate change, but also socioeconomic, sociocultural drivers of disease emergence. And I think, you know, this was in October, end of October 2019. None of us at the time. It was a very nice meeting, by the way. We were there in person. We could still give each other hugs and have a drink together. Those days have sort of seemed quite far away now. But none of us could have thought, you know, basically 35, 40 days later, we were just at the beginning of a pandemic. So it was very, very timely, but it does set the stage on how we need to deal with these issues. We're talking a lot about the markets, wildlife markets at the moment in Southeast Asia and maybe in other places. But basically, it's about these interfaces that are allowing viruses and pathogens to slip over from one container, the wildlife environmental habitat, into the human population. And then because of our hyperconnectivity and other drivers, spread across the globe. So I think this sort of holistic approach to medicine and the way we prepare for pandemics and epidemics, One Health really does provide a great framing for us to do that and not forget, you know, the many, many drivers that we need to consider.
Yeah, absolutely. Thank you. How do you foresee a paradigm shift in the way we have perceived health so far and now compared to what happened with COVID-19? So maybe in other words, has COVID-19 elicited or precipitated a paradigm shift, the way that we perceive health as a whole, but also human health in particular? Yeah,
so obviously at the moment everything is focused on, and rightly so, is focused on, you know, human health, and especially on the front line staff, their security and the work they're doing, and you know that is the most important at the moment. Here in New York, we're really in the midst of a huge outbreak at the moment, and every day we've got to be thankful to the people going out and, you know, working and saving lives. So absolutely. But there has obviously been a real shift, a massive shift in the way that the environment is being perceived. So I'm very optimistic and actually nearly surprised at how strong and fast this shift has occurred. Basically, all multilateral organizations have come out with very, very strong statements on preserving and conserving the environment, limiting our encroachment of the environment in order to limit future pandemics. The Ministry of Environment in Germany has issued a very, very, at the minister level, a very strong statement saying we need to ensure a healthy environment for for our own health, for our human health. So this is really, it's like a snowball. You know, we started back in January pointing this out, and other organizations have joined, and it used to be just the NGOs maybe the first few weeks, but you know, now the CBD, WHO, just about all governments have issued this. So there's no going back as far as I'm concerned, and we need to all be attentive to also make sure that we don't fall back into our normal behavior as we get back. And then, of course, there's this huge amounts of financial aid and support which is being made available right now. We do need to make sure that that is also paired with climate change and environmentally friendly strategies, and not just supporting a backward-facing economy.
Absolutely, Chris. Thank you. That is very interesting indeed. Just for my last question, I'll just come back to the Berlin principles that you already mentioned. So as you just explained, together with colleagues, and I had the honor to be part, and in a really true inter and multidisciplinary effort, you have launched those Berlin principles that followed from the Manhattan principles at the German Federal Foreign Office, and that was back in October. And then, of course, we didn't know that those principles would be extremely. So before we open up for Q's and A's, could you explain about a little bit more in detail about the Berlin principles and the very essence of those principles. Maybe how they encompass or include the One Health concept, and why they couldn't be timelier just now.
Yeah, so it's really basically, as I said, it's sort of an update of the 2004 Manhattan Principles, which really got a lot of traction, and many organizations obviously use these Manhattan Principles to even address One Health. You know, the OIE took it on, FAO, and so on. But one thing was clear: the world had changed in those 15 years since 2004, so we did need to go back and look at them. And if you remember, we did this word cloud experiment. We had a word cloud from 2004, and then we had one as comparison from 2019 at the meeting. And you know, it's quite fascinating. In the 2004, climate change didn't even appear in the word cloud, which is kind of worrisome, because it's not like in 2004 no one knew that there was an issue with global warming at the time. So that was one of the key factors. Then the environment was certainly underrepresented in 2004, and that is now central. If you look at the 2019 cloud, the environment and climate change as main drivers is, you know, central. So the Berlin Principles are 10 principles, and as you know, you can go on the webpage to WCS webpage. There's a white paper on it. You can look at it, and we're working hard to get it submitted this week. So we're keeping our fingers crossed that we'll actually get it submitted, and then you can see it in a peer-reviewed format and update it to obviously the ongoing pandemic. But basically, what this document does, it urges institutions to implement a One Health approach. That means, you know, environmental health, human health, and veterinary health, and regard all the different drivers. Also, one of the things I think is important, we also specifically point out that we need transsectoral or multisectoral funding streams. So if the two of us wanted to work together on a project somewhere in Africa, and we wanted to have you know, an anthropologist, a behavioralist, social scientist, yourself, a veterinarian, it's really hard for us to find funding for that, because our own funding streams are often in silos. And so trying to break down these silos on a disciplinary level, but also on a funding cycle, is something that we were really urging. And I would really suggest you go visit the site. There's a lot of detail in there. I could obviously read them to you now, but I don't think that's, I'm happy to go more into them, but there's a lot, you know, on land use change as one of the big drivers, agro-industry, those are the things we need, emissions, perverse incentives, things like that we need to tackle. You know, we've got as this pandemic, we're all at home and we're sort of thinking, oh, how are we going to get into the, you know, after the hammer, now we're in the actually much more complicated dance phase, or some of us are moving there, some countries. We don't forget some of the really big challenges that are still out there, and that's, you know, climate change, land use change, and so on. So I hope this will provide a great frame to work together in the future. Well,
thanks a lot, Chris. And we are doing perfectly with time. So it's the first half an hour is already over, and we have got very good questions coming in. I think there's actually, at the moment, there's no point of sorting those questions. This is just a hint to my collaborators in the background who you don't see. But I just start with the first question. And again, if you don't want your name to be read out, just use the anonymous button. So we have a first question. I think this question is really interesting, from David Simmons. I read it out now to you, Chris. Must we be more nuanced with our responses to wet markets? As you mentioned, there's significant dependence on these as a source of nutrition in much of the world. Rather than a blanket ban, blanket bans, which are likely to drive trade underground, are there not interventions that could be implemented to improve the safety and monitoring in these settings? So a less radical approach. Is there anything in terms of interventions that you could enlighten us on?
Yes, I mean, I agree with, it's a good question from David. So I think one thing one has to really understand is when an issue like this pandemic starts off, you got to get messaging out there, and the first messaging in the first few weeks is very blunt, basically. And as WCS did, we really pushed this the market and the wildlife trade, and we have a lot of knowledge. WCS, the Wildlife Conservation Society, is the largest counter wildlife trade organization in the world by orders of magnitude. So we really, really know a lot about illegal wildlife trade, and understand the intelligence, and have huge programs that do that. So we do have a very clear understanding. And the first thing I remember when we started talking about banning wildlife trade was my worry, oh, it's all going to go underground. So I contacted, obviously, my colleagues who run the counter wildlife trade, and the unanimous answer was, it is such a smaller portion than what is going on and tolerated on the markets in Southeast Asia, that any win would be very helpful. And the other thing is, as Simon points out, of course, there are nutritional demands that have to be met, but those are mostly not in Southeast Asia, and they are certainly not in the big urban centers. So it's these huge commercial markets, and if you look at the ban that we've been pushing, it's a ban of commercial trade. It's not about sustainable use of wildlife in any context or any setting. It's really about the huge commercial trade. There is really no reason for the big multi-million mega cities to rely on wildlife trade. This is a question of taste, and many times it's a luxury item. So we need to be very clear. That being said, in Africa, of course, the situation is different.
Yeah, absolutely. No, thank you. Chris, the next question is from Louis Abdou Amor. How long does it usually take to see a zoonotic spillover? Could any evolutionary study help trace some of these in advance as measures to predict and avoid epidemics?
Yeah, that's also a really good question. So there is, there's probably related a little bit to Simon's question. There's this idea of sanitizing the markets. And that means that we would increase our surveillance and monitoring of the wildlife species that are traded there. And remember, we do have large global programs that do that. Predict program funded by USAID has spent more than 10 years now looking at the wildlife market interfaces, sampling, hundred thousands of wildlife have been sampled, sequenced, and so on. The problem is with this is, how do you predict when it's going to spill over? Which one of the 500 coronaviruses that you have found is going to be the next candidate? You just don't know which one's going to be a bad actor. Most of them are insignificant. They may spill over, but won't cause disease. So if you put in a monitoring, and I've spent weeks talking about this now, is that you find a virus which is 96% full genome similarity to SARS-1, let's say, and you found that in a porcupine. What are you going to do? You don't know if it's going to cause disease. You don't even know if it's going to be able to replicate in humans, and so on. So it's really difficult to put that kind of monitoring in place with a multitude of species that we have to deal with. I hope that answers the question.
Good, thank you. Then we have a question from Tamara Lucas. Tamara, very nice that you're on the webinar. She says, really fascinating so far, thank you. Regarding the wet markets, as explained by Chris already, to what extent do these exist as food sources? I think we have answered that partly already. And if that is indeed one of the primary functions, which is more the case for the African markets, then are there or could there be any bottom-up initiatives to simultaneously address diets that consume animal products? For example, to reduce the animal component in the diet, in the background, through healthy eating guidelines. But of course then, I mean, this is now, so full stop, that was the question. but then it's a trade-off with the protein intake that you really, really need in large parts of Africa. But back over to you, Chris.
Yeah, so many things are going in parallel. You know, you see the ban, that's the thing that everyone sees at the moment. Everyone's jumping on that. But in the background, of course, we have we and many other organizations working with partners on providing alternative protein sources. Also trying to regulate the type of species that are used. Remember that the wildlife trade as such for consumption is also one of the big drivers of species extinction. You know, 15 years ago, none of us knew there were that many pangolins in the world. I mean, we knew that how many species there were, but just the sheer number of pangolins which are captured and eaten is unbelievable. If I'd spent 20 years in Africa in the bush on a regular intervals, basically never saw a pangolin, but they were able to, you know, ship 5,000 of them to China. So there are a lot and more, many more than 5,000. I'm just saying there's a lot going on. So it contributes to species extinction. So some of the mitigation measures are either providing alternatives, changing the type of species that are consumed. And on the alternatives, one of the things that's really changed is that we've got a vaccine now, a thermostable vaccine for chickens for Newcastle disease. So for the first time, even in the more remote areas of Africa, we can actually raise chickens successfully, which was something that was impossible 3 years ago, or even 2.5 years ago. Because there was no thermostable vaccine, that means basically the chickens you'd start a project and they would all die of Newcastle disease. So that was kind of not very sustainable. So that's changing. Invertebrates are making a huge impact as well. So using invertebrates either directly as a food source, protein source, but more importantly, often to raise chicks, to create a market stream for chickens. So all these things have to go on side by side. Alternatives, education to change the consumption patterns, and if consumption is necessary, to really decide on which species is sustainable to eat.
Thank you, Chris. And the next question is from Barbara Horowitz. Barbara, also very nice to have you on the call, on the webinar. So Barbara is asking, what are the most important climate-related factors driving accelerated spillover events?
Yeah, hi Barbara, nice to see you online. Hope you're keeping well. So probably the most important climate-related factors are those related to vector-borne diseases. So spillover events, you know, obviously malaria, but also dengue, chikungunya, and Zika. We're really seeing a range expansion of the mosquitoes, of the vectors northwards. Also some of the tick-borne diseases, we're seeing range extensions. And then basically this whole concept of any kind of climate change creating stress on the environment, and basically, you know, this nice saying for which we don't have that solid scientific evidence in each context is basically the more you stress the environment, the more you shake out the pathogens and allow them to spill over. And that sounds like very airy-fairy thing to say, but on a precautionary principle, you know, that's something that should be a guiding sort of a mantra for us as we devise studies to get this scientific evidence for some of this. You know, we know some of these drivers, you know, deforestation and range expansion of the vectors in very context specific. We know it works really well for malaria in Borneo, but it has not been able to replicate that in Africa, for example. And then again, we know some of the deforestation Zika studies from Mesoamerica, and those haven't worked in other contexts. So basically, you know, we need to be very cautious in overstating some of the facts, but also on the other side, on a precautionary principle, we've got to assume more or less works in many of these complex systems.
Okay, thank you. Next question. And next question from Philippe Maric, and he's a PhD student. So Philip is asking what might be necessary to merge frameworks like One Health, eco-health, and planetary health, and then between brackets, possibly even global and public health, so to merge everything, to aid their respective impact, strength, and have an overarching framework for health medicine around the globe going forward.
So I couldn't agree more. We need to do this. I have a strategy. It involves wine and beer and sitting together. So we need to wait till we can reduce our social distancing. I've actually been talking to Andy Haynes just recently, just a few days ago, and I said, you know, we need to find a way to bring this all together. And Andrea and her colleagues have also been helpful in pulling us all together. So I'm very optimistic that as we move forward in the next 6 months, I don't know if we have to come up with a new term, but at least we'll find an umbrella where we're all comfortable. And I think we all agree, and it's more of a historic problem as these things developed. I think planetary health was very frustrated with some of the One Health approaches, which had seemed very narrow. EcoHealth similarly decided there wasn't enough environment in One Health, and so on and so forth. I think we will all find ourselves under one umbrella, but I agree with you, we need to come up with a term. It's just bad marketing, and we need to get on it. So yes, beers and wine and some time together, and we'll work it out.
Some good discussions. Yeah, if I may just chip in, I mean, you know, we try to address some of those issues, of course, how to bring everything together, and if we should bring everything together through the Lancet One Health Commission. And in a way, I mean, to be quite challenging, is it really important how you name your child? And it's important that, you know, all these different organizations and institutions, if they go into the right direction, in the same direction, and if they agree to collaborate, I think this is already a huge step forward. But a very interesting discussion, and certainly very, very long discussions are still needed with lots of participants to define our common and overarching objective, and also the direction we want to take this. But thanks very much for this question. Now the next one. This is anonymous. Bats are a well-known reservoir for all sorts of viruses without themselves getting sick, or at least symptoms. Would it be useful to fund studies into solving bats' immune systems dealing with these viruses in order to gain possibly new insights in combating these viruses in other animals and humans?
Yeah, so that's a really important question. Just that, I was going to say off the bat, that's not a very good way of trying. But just right at the beginning, I want to point out the poor bats are really getting, you know, trashed every day in the media and everywhere. Bats are really, really important. We cannot survive on this planet without bats, and we need them, you know, as pollinators. Their pest control contributions, the services they provide are just extraordinary. I mean, the economic importance of bats cannot be underestimated. And anyway, they're also superbly cool. Yeah, so any of you who have slight fears with bats, just look at them. Now, one of the things that's been brought up a lot is that bats carry more viruses than others. As a reservoir, like any other reservoir, they normally don't obviously develop symptoms or clinical symptoms, or there may be costs associated that we don't know with carrying these viruses. And they do have a unique dampened immune system and an immune response, which is thought to be due to their, because of their evolution of flight ability, so which causes a lot of muscle destruction. And so the idea is that the immune response is somewhat dampened so as not to have this a reaction to cellular debris. That being said, there's just been a new study which came out last week, I think it's last week, which looked at all the viruses, known viruses, across all the different taxa. And basically what comes out is that it's actually host neutral. The amount of viruses does not vary by host. It's only the taxa that have a lot of species have a lot of virus. That's why the rodents and the bats are, you know, really high up there. There's just a lot of, you know, there's, I think, 1,420 bat species. So that's a lot of potential species for viruses. So yes, I think, you know, there's a lot of work. I'm working together with a close colleague of mine, Nicholas Huber from the vet school in in Vienna, and we're looking at the immune response. He's an expert at looking at innate immune responses and been working in Congo on that. There's other studies going on. One of the things we don't know is while they harbor, these bats will harbor the viruses. For example, we know that they carry Marburg viruses, we know that. But when do they shed them, and why do they shed them? So there's this idea that there's a seasonal dependence on shedding. There may be, while they have their young, that could be, that would be a pretty classic approach. And of course, that would then help you mitigate the risk. You could teach your children in your village to say, at this time of the year, we're not eating the figs which are lying around, which the bats have also been eating on. The rest of the year, you can go ahead and eat them. But at the moment, this 2 months of the year when they have their pups, we won't eat them. So that would be one approach. So learning how to live safely with bats and other wildlife is a really integral part, and that needs to be based on solid science, of course.
Thank you. Next question, again anonymous, in reference to its environmental impact. Our proximity to large groups of animals and the increase in antibiotic resistance, how important is the animal agriculture industry in transmitting zoonotic diseases?
Yeah, so while, if we just refer to the emerging infectious diseases, 30% come from domestic animals, and that's mostly agriculture. So they do play a very important role. And what's pointed out basically in this question is it's the large agglomerations of these animals which provide great opportunities for viruses to develop new traits, because you have this huge pool in close proximity to each other. They can actually transmit between the animals. And mostly, they're often stressed as well, so that, enhances shedding as well. So they do play an important role. From the emerging infectious diseases, about 70% have their reservoir or evolutionary host in wildlife. So it's a bit lower in domestic and livestock. But that being said, we've also spent, several thousands of years, 5,000 to 6,000 years, co-evolving with most of the livestock. So we have a better immune landscape as well in respect to our livestock. That being said, it sort of has that word in there, antibiotic resistance. That's one of those other huge problems, which has sort of got absolutely, it's like it disappeared now in the last 4 months. But is still out there and is waiting for us as we get through this pandemic. So antibiotic resistance on a global scale is obviously one of the huge concerns. I think it's #1 on WHO's list of concerns at the moment, if I'm not mistaken. And that's something we're going to address. And obviously agro-industry has a big part to play in that as well.
Okay. The next question is rather big, and it's a different direction. I'm not saying it's anonymous and most likely from a mother, but could also be a father. It's a parent, I would say. In recent years, there has been a movement in favor of education through nature for young children. Oops, now the question has gone.
I read it though before. I think I can answer it.
So in summary, exactly, the question has just been moved somewhere. In summary, it was basically we encourage children to be out in nature, to get close to animals. Should parents, now with all the zoonotic diseases, should parents still encourage young children to play with animals, be out in nature, and what is the risk of contracting zoonotic diseases?
So obviously it's not my expertise, I have to really say, but I'm happy to answer that. It's something that's really close to my heart. So going out into nature and being in nature and interacting with wildlife in the sense per distance, I'm not talking about cuddling things, but seeing wildlife, just being out in nature is just essential, obviously, for your mental health. So this idea of bathing in nature and being out in nature is really essential. And we really see that. I live in the Bronx now, and I really see, in our underserviced communities here, the disenfranchised just do not have access anymore to any parks. It's very difficult for them to get there because they need to use a car. things like that. We need to make sure, especially in our cities in the future, that we do provide these green space, the nature for people to go out and be there. And then for children, you know, there's a famous comedian who always said he used to swim in the Hudson as a child, and it was so polluted that he never gets sick anymore afterwards. And you know, that's a story, of course, but we all know that priming your immune system has to happen at some stage in life. It's unnatural if you keep your children locked away and they don't ever get in touch with any, you know, whatever it is. You want to go extreme fecal matter or earth and things. So as far as I'm concerned, and I hope there's someone on here who's maybe a bit more of an expert, a pediatric internal medicine expert, but I would say you need to expose your children to wildlife, but also to dirt and mud and rain and everything. It's not a life without that. I don't know if that's good for it. That's a veterinarian there telling you what to do with your children. I'm sorry about that.
I think it's a pretty good answer. And of course, to keep children out of nature, I think is not an option either. Absolutely. We have other questions, and I've got a question now, and I think it's actually a twofold question. Not so sure about the relation between the two parts. So first part, have you considered the misuse of antibiotics in connection with viruses? Most people die with COVID, not of, due to bacterial infection where antibiotics become inefficient. I have to say that this has not been proven yet. It is an assumption, but it may well be the case. We don't know. Certainly, antibiotic resistance also plays a role here. That's the first part of the question. So antibiotic resistance and viruses and COVID. And then in addition, the condition of the oceans endangers crustaceans who clean the oceans from viruses, among other things that they eat. So not sure, maybe we just take the AMR, the antimicrobial resistance and viruses. Chris.
Yeah, I think, the misuse of antibiotics or the incorrect use of antibiotics is a general problem, and it's not related to COVID. That's a general issue. All of us have been faced with this. I come still from an era, I was a rural veterinarian back in the early 90s, end of the 80s, 90s, and man, we didn't worry too much about the way we used antibiotics. It was in the feed. Any cow that sneezed got a proper dose of antibiotics. And we've changed those practices, of course, and the profession has. And similarly, human medicine needs to and has changed their prescription and use of antibiotics. And then also it's the use in feed and things like that has been banned in most countries around the world. And then the waste of antibiotic and taking care of the waste has moved forward. So I think, yes, it's a problem, and it's a massive problem, but it's not directly related to COVID in any way.
Okay. Excellent. And then the second part, of course, maybe this is just a statement that the condition of the oceans, if the oceans are or the conditions are not good, then crustaceans that clean the oceans, of course, are also affected, and that may again impact on the viruses that we have to deal with. Okay, then it keeps jumping back and forth. Okay, I find my question again. Here we are. This is from Johanna Rivera, and this is a question around the encroachment on nature. So can you speak about your view on how the contribution of industrial agricultural production in Africa, in brackets Ebola, and Asia, in brackets COVID, could be contributing to the loss of habitat and to changing the ecologies of these wild species, where before they would be typically confined into deeper forests, and now they're basically upgrading to human habitats because of loss of their habitat, impacting how pathogens are spreading. So the encroachment of the civilization, of our civilization.
Yeah, so this is, I think this is one of the crucial and central roles of, and this is how I think the conversation is pivoting now away from the markets, which are super interfaces, but pretty simple actually. You know, it's obvious if you bring that many wild species together, that's not a good situation. But what's much more insidious basically is the habitat destruction through land use change, either as pointed out here for agriculture. And what you're getting is these frontiers of destruction. And these frontiers of destruction is where people are interacting with the forest, the formerly intact forest, and the incursions will be, you know, between 500 meters, but also 2,000 meters, 3,000 meters in the forest. You can't go much further really for hunting, wood collection, and so on. So you're actually in contact with wildlife there, and you're bringing this wildlife back out to the street. And so that is really important. And you know that outbreaks of Ebola have been linked to land use change, especially to deforestation. I don't think the studies as such are that solid yet. They've got a lot, there's 2 or 3 very good ones out there, but I think we need to still work on to quantify that impact. But obviously, if you disrupt the forest, you're going to change the bat habitat. If we assume that the bat is a reservoir, the fruit bat, then you change its flight patterns, you'll also stress it, and suddenly you have the bats roosting in your village, and that obviously causes a problem. One thing I think is also important, just quickly to add, often this deforestation and destruction environment is also then paired with, you know, under-resourced communities and public health services in the same area. So it's a sort of a double whammy. You've knocked down the forest and you remove the public health diagnostic possibilities in those areas.
Very good. We have many more questions, I'm afraid. We only can take one more. We have got 4 minutes to go. There's also a question from our co-chair from the Lancet One Health Commission, from Global Health KCCR, John Amwesi. And he was asking, and just quickly summarizing this question, he was asking, Chris, can you give some advice about, you know, people need farmland and how to navigate this against the destruction of nature in terms of policies, governance? Maybe just a quick sentence, because that was the very, very last question. And I just wanted also KCCR to get a voice here. And then we need to take one more question, I think.
Yeah, so, you know, it's a very complicated thing, as you well know, and one sentence is not going to do it justice. But obviously, one thing we need to address is the contact area. So as we convert land, we need to make sure, where does it stop? Land conversion also really has to integrate soil health. That's something that's often disregarded at the moment. We need to make sure it's sustainable production and high yield production on those surfaces. So we need to provide and strengthen the knowledge and capacity to actually use that land in a sustainable and high yield way. And then we probably have to focus a lot on this contact area.
Thanks. Very last question. It's from Jeanette Magnus. Thanks a lot, Jeanette. Very, very pleased to see you online. She's asking, it's an educational question. Chris, from an educational perspective, given traditional curricula for health sciences and medicine, what do you see as the 3 important initiatives we can take to better prepare our graduates for the One Health global concept or the next pandemic?
Yeah,
so
also
important initiatives.
Yeah, so one of the things I think really important, and I'm very proud of this, well, you know, 15 years ago, back at the University of Veterinary Medicine in Vienna, we initiated what was called conservation medicine, another term for a One Health approach. And the final year graduates can now choose that as their main track. So we do have a small group, always it's about 12 a year, who go through the program and come out with a One Health education. So I think the universities and educational facilities need to provide a One Health, or whatever you want to call it, perspective on health as an education opportunity, and to value that. We don't only need medical staff that treat individuals. We need this very strong, wide, holistic approach to public health. And I think we need to facilitate that and make sure that gets integrated into the curriculum. That's, you know, I think always the human medicine environment is like, what room were you in and how was the air just outside your house? But we need to just broaden that and just say, and what are all the drivers? And, you know, I think for me, living in the United States, especially out here in you know, where there are underserviced communities, this disease has really broken apart the tapestry of life here. And it really shows how important and the economic drivers are for the spread of this disease and its impacts. So we can talk about everything, but if you have no public health, you have no health care, you have no sick days paid, you are living from paycheck to paycheck, the impact of this pandemic is much larger. So if we disregard these drivers when we talk about health, we're not going to go anywhere. So yeah, we need to make sure that gets into our educational curriculum.
So again, integrated approaches and One Health at the core of everything. It's been a pleasure. It's now 3 o'clock on the dot, so very sharp. I just want to thank you, Chris. It's been a real pleasure, and it's never enough time chatting with you. I want to thank also the team from the Center for Global Health in the background. They have maneuvered everything really nicely. Thanks a lot, and to the great audience. I'm sorry we have, I think, 9 open or 8 open questions, but Chris, you said that those people could actually email you. So feel
next week. Next week, please. I'm bogged down.
So there will be 9 people mailing their questions.
Absolutely, absolutely.
No, thanks a lot, Chris. It's been
Thank you very much to you and your team.
Thank you to the audience. Bye-bye.
Thanks, everyone. Bye-bye. Everyone have a great day. Stay safe. Bye-bye.